Hi everyone, my name is Dr. Deepa Halaharvi. I'm a breast surgeon as well as a breast cancer survivor here in Columbus, Ohio.
And hi there, I'm Mark Cripe. I am a breast cancer and melanoma surgeon, also here in Columbus, Ohio. Today we're going to be talking about different types of mastectomies. You hear the word mastectomy, there's a lot of different meanings. We're going to explain how all of that can be confusing and hopefully make sense of the word mastectomy. So mastectomy, what is it?
Mastectomy is, I think of it as a surgical removal of breast.
A lot of people think of mastectomy, they hear the word and think, my grandma had a mastectomy and it was terrible and her breast was gone, but the muscle was gone and the shoulder was hunched over and her arm was swollen. That's not what we're doing anymore. So that's what people think of oftentimes when they think of a mastectomy. We call that a radical mastectomy, and that's something that luckily we don't really do that often anymore.
In probably around the 1970s, we started doing what's called a modified radical mastectomy. And what that is not just removing the breast tissue, the skin, but also we remove lymph nodes, and we usually say level 1 and level 2 lymph nodes.
We've moved from there, if you're not taking lymph nodes, to what we call a total or simple mastectomy, where you're just removing the breast tissue and you're not removing lymph nodes. When I started, lots of times you'd see extra lumpy tissue around the mastectomy. So we talked about removing the breast, maybe leaving some of the underneath the chest wall, the little folds or the side tissue, and started removing that about right when I started doing mastectomies because I didn't like it. But now
it's actually called, the fancy term is aesthetic flat closure. And a lot of patients come to us asking us about aesthetic flat closure. The interesting thing is I thought all the surgeons close and using, the aesthetic flat closure principles, which basically is just removing that excess skin where there is the inside, the sternum, or the outside underneath the armpit. We women sometimes tend to have excess skin and excess tissue underneath the arms. And with aesthetic flat closure, we're able to remove with different techniques. So that's been really a great addition. And of course, being trained by you, I didn't know any different. I thought everyone in the country performs aesthetic flat closure, but I was one of those lucky breast surgeons to have been trained by Dr. Cripe. So,
well, thank you. But stay tuned. We're going to talk more about that in another podcast. Any of those mastectomy you talked about, the simple, total, or aesthetic flat closure, can be performed with lymph node removal. And we talk about a sentinel, or the first couple lymph nodes, versus, as you had mentioned, the axillary node dissection, where you're taking the levels 1 and 2. If we do a simple mastectomy plus lymph nodes, we then call it modified radical mastectomy.
There's also what's called skin-sparing mastectomy, and basically what that is, with the advancements of mastectomies, different types of mastectomies, there have been advancements in reconstruction. So a skin-sparing mastectomy essentially is you leave the skin, you take the nipple and the breast tissue, and the plastic surgeons come right behind us, either put in a temporary implant called a tissue expander, or sometimes they use your own body tissue, either a deep reconstruction or some other type of reconstruction, but plastic surgeons are able to use your own tissue. So that has been a great advancement.
And after the skin-sparing mastectomy, the next mastectomy we talk about is a nipple-sparing mastectomy, where you're leaving the entire skin envelope we talked about and removing all the breast tissue. I had a patient ask me one time, is it kind of like carving a pumpkin where you're taking the insides out and leaving the outside there? And I'm like, yeah, we're, I guess, a fancy pumpkin carver.
I don't think I would think of it that way, though. I tell my patients mastectomy is essentially removing a pillow from a pillowcase. So you have this pillowcase, the pillow is removed. Plastic surgeons have the capacity to do the reconstruction using that pillowcase. And so with the nipple-sparing mastectomy, we are able to preserve not just the skin, but also nipple. And so when women looks herself in the mirror, it looks like she has her own breast, even though the breast tissue has been removed. It's her skin. But again, the advancements in plastic surgery world, women do look like it's their own breasts. The most recent advancement we've been super excited about here in Columbus, Ohio, is sensation-preserving nipple-sparing mastectomy, is where not having sensation, it's a big deal for women. Mm-hmm. Women want to feel hugging their husband or their kids, or, want to have that sensation for sexuality, for different purposes. So that is a big quality of life issues that we as surgeons in the past did not do a good job of talking to our patients, but we are very fortunate to bring this procedure to Columbus, Ohio, where we are able to preserve the nerves at the time of the nipple-sparing mastectomy. And the plastic surgeons use those nerves to reconstruct using a graft.
The most recent type of mastectomy we're doing now is called a Goldilocks mastectomy. So that's the latest iteration of all these different mastectomies.
I'm super excited about Goldilocks mastectomy, and you have to stay tuned to listen to the risk factors, the advantages, the disadvantages, and who's a great candidate. So stay tuned for that.
So when you hear the word mastectomy, it's not your grandma's mastectomy. Lots of different types of mastectomy. It's just removing the breast. And then we talk about either reconstructing the breast, not reconstructing the breast. So I hope that this helps with you understanding a mastectomy and why it can be so radically different from patient to patient, because there's different types of mastectomies. Thanks for joining us.
Bye.